TNF-alpha target introduction. Tumor necrosis factor alpha is a pro-inflammatory cytokine involved in systemic inflammation and is one of the cytokines that make up the acute phase reaction. It is produced mainly by activated macrophages, although it can be produced by other cell types, such as lymphocytes, natural killer cells, and neurons. TNF-alpha is a key regulator of immune cells, able to induce fever, apoptotic cell death, sepsis, cachexia, inflammation, and to inhibit tumorigenesis and viral replication. Biological role of TNF-alpha. Inflammation. TNF-alpha plays a significant role in the inflammatory process, making it crucial in the body's defense mechanism against infections and injuries. It mediates the inflammatory response, leading to the recruitment of immune cells to sites of infection or damage. Biological role of TNF-alpha. Cell signaling. It functions by binding to its receptors, TNFA1 and TNFA2, initiating signaling pathways that lead to various cellular responses, including inflammation, cell survival, and apoptosis. Disease association. Dysregulation of TNF-alpha production has been implicated in a variety of diseases, including autoimmune diseases, septic shock, and certain cancers. TNF-alpha as a therapeutic target. Given its central role in inflammation and immunity, TNF-alpha is a prime target for therapeutic intervention in chronic inflammatory diseases. Several biologics have been developed to inhibit TNF-alpha with significant success in treating autoimmune conditions. Mechanism of action. Binding to TNF-alpha. The inhibitors bind to TNF-alpha, blocking its interaction with TNF receptors on cell surfaces, thus inhibiting the downstream inflammatory signaling pathways. Reduction in inflammation. By preventing TNF-alpha activity, these therapies reduce the production of other pro-inflammatory cytokines, leading to decreased inflammation and tissue damage. Clinical applications. TNF-alpha inhibitors have revolutionized the treatment of several chronic inflammatory diseases. Rheumatoid arthritis. They reduce joint inflammation and prevent long-term joint damage, improving patient quality of life. Inflammatory bowel disease. In Crohn's disease and ulcerative colitis, these inhibitors help to maintain remission and reduce intestinal inflammation. Psoriasis and psoriatic arthritis. They help to clear skin lesions and reduce joint symptoms. Ankylosing spondylitis. These agents reduce spinal inflammation and improve mobility and function. Lifetech can provide products related to TNF-alpha targets. Infliximab biosimilar, golimumab biosimilar, adalimumab biosimilar, afelimumab biosimilar, narelimumab biosimilar, and other products. www.alpha-lifetech.com. info@alphalifitech.com